5 variants of COVID-19 are now traced to our region, and a local expert says we aren't quite out of the woods yet when it comes to this pandemic.
News 8 Now's Isabella Hulsizer introduces us to the doctor that's tracking the spread of these strains in our community.
We've been sequencing COVID-19 strains here at Gunderson since March of last year.
So far, Dr. Porak Kenny and Dr. Craig Richmond have sequenced 1,603 genomes.
And for much of that time, we were tracking the variants that emerge within the virus genome as it replicates. And we were able to build up family trees of the virus like this that allowed us to track how the virus was moving.
To break it down, when viruses make copies of themselves, sometimes they make a spelling mistake in one of the letters of their genomes, which causes mutations. By tracking these mutations, Dr. Kenny and Dr. Richmond were able to record families of the virus spreading through groups like college students, meatpacking factory workers, nursing homes, and various other populations. Dr. Kenny knew at some point global variants would make their way to La Crosse. It was just a matter of time.
We've been tracking a total of 5 of them here in our region.
The 5 are a Southern California variant, the UK variant, a New York variant, the Brazil variant, and the South African variant.
3 cases over the past few months of a strain called P2 that originated in Brazil. That's something that came into our region, seems to have spread a little bit, but we haven't detected much onward transmission from that, which is quite encouraging.
Within the last week, the South African variant was detected by the team.
And it's one of those that are giving rise to most concern because some of the vaccine trials that were done in South Africa with the vaccines that we're using now didn't work as well there as they worked elsewhere.
There have also been traces of the UK variant. Dr. Kenny says the biggest concern with that strain is the transmission rate.
So the B117 in particular is probably somewhere between 50 and 70% more transmissible than the older, COVID-19 strain that we've been dealing with for quite some time now.
Kenny says another strain has been dominant in one county in the region as well.
There's one called B1526, which is a strain that emerged in the New York area, again, towards the end of last year and came to dominate there. That's a strain we've recently detected in Trempealeau County, and there it does seem to be associated with an outbreak centered on a high school.
Dr. Kenny says he is most surprised the South African variant made its way to La Crosse in such a short amount of time.
We detected the 5th substrain of that virus, the 5th example of that virus in Wisconsin. And I think, anytime you find something that's so rare in a relatively small community like ours, it makes you concerned that really what we're looking at is a tip of an iceberg.
Dr. Kenny says he and Dr. Richmond will continue to process 64 of these samples per week to uncover any iceberg situations. In La Crosse, Isabella Hulsizer, News 8 Now.
And Dr. Kenny also says in most cases the vaccine and prior exposure will protect people against the variants, but still to be cautious. And he says it's still important to practice all the precautions that doctors have talked about and advised you with over the past year.